Okay. Hope you all are enjoying your bank holiday weekend, long weekend.
Gardening.
We have
Connecting
some
with
sun now.
nature.
Sun is out, so yes, it's a good day to go out as well.
Yes.
But Steve and Gidre are enjoying good weather in India.
Oh.
Yeah, we're enjoying good weather, of course, but we're also enjoying the Panchakarma.
Yes. So why don't the two of you share a little bit about your experience about Panchakarma so far? What treatments have you undergone? Which is your favorite treatment? So everyone can live Panchakarma through you guys.
Yeah,
Enjoy Panchakarma.
Yeah, we can try, but it's very individual, of course.
Yeah, so everyone's treatment is going to be slightly different. So we'll start with you, Steve. If you can say what you have enjoyed the process so far, how you have felt so far undergoing the Panchakarma. Yeah?
Yeah, sure. Overall, I've enjoyed it. I'm not unfamiliar with detoxing. Certainly, I've done the 28 days as well on more than one occasion. And I've also done herbal detoxes other times other than the Ayurvedic style. So I sort of know what to expect. However, the Panchakarma, it's more intense. I had to do Virechin.
Is it done?
It was done last Saturday, actually. It was done last Saturday. And I actually found it tough, not from the purgative side, because as I said, with previous detoxification, I've experienced having to visit the toilet very frequently for a time. In my case, it was something like 12 times over 8 hours or 8 or 9 hours. Some here have experienced up to 20 or 22 times actually visiting the loo. But for me, what the hardest part of it on that day and on subsequent days was the fatigue or the tiredness. I felt so weak. And some of us were a bit confused by the instructions because I was told actually not to move about, to keep on my feet as much as possible to help the process. And if I was really, really tired, to sit down, but not to lie down. And I found that really, really difficult. In fact, I got a slightly different answer when I asked about this later. And they said, well, if you are so weak, you are allowed to lie down. So that was during the Panchakarma day itself, the Virechin day. Subsequent to that, I've had a sort of alternating days of not much energy and some better days. And the food following the Virechin day is very interesting because as soon as you've finished, the discharges, the purgation, you have a sattvic khichdi. You just eat a meal as soon as you're finished. It's a solid meal. Whereas that seems a bit counterintuitive because for me, I would have expected just to have liquid. But I was told by Dr. Hamang that this is actually to fill the void because you've emptied everything so much, it's completely empty, and you need something solid just to fill the void. And then you follow with 3 days of increasing the solid food, starting from a very liquid food up to the 3rd day, which is more solid, and you go on to the normal Panchakarma food.
Yeah.
Without going on any more than that, each day with one of the doctors taking her pulse and following it along and adjusting the Panchakarma treatment, progress is made. And I like having the heart data, the spinal data, and the general massage, which is followed after the Virechin day with steam. All wonderful.
Yeah. So, Steve, I want to answer your question about, not answer your question, but tell you why you're feeling so fatigued? Because like
Yes,
Dr.
please.
Hemang said, you have cleansed everything. You've flushed out all the toxins from your body, majority of your toxins, and then your body is fragile, right? So hence, feeling a bit tired or drained is very normal. And the reason we say not to lie down, because sometimes we had seen in the past when we would let people, we would tell, okay, you can lie down for a bit if you're feeling tired. People used to fall asleep. And
Yes.
when you fall asleep, your system also falls asleep, and then that interrupts the process. So that's why I tell, when I used to be there, I used to tell my patients, bring a book that you enjoy reading or some activity you like to do, sit and do that, or listen to music, walk around a bit, and don't just sit in one place or lie down or fall asleep. Mainly it's not to fall asleep, because sometimes some patients used to say, okay, it's a good day, a nice bed, let's go to sleep. But then what happens? Your whole system falls asleep as well. So that is why. And regarding your favorite treatment, Hath has always been my favorite treatment. It's so relaxing, it's so calming, and the Shirodhara. These two have been my favorite treatments, because I remember when I used to do Shirodhara, I used to fall asleep there. Shirodhara and Hardhara, I used to fall asleep. And Shirodhara and Hardhara, I have experienced with some of the patients over there, as well as myself. There's a burst of emotion sometimes. A lot of emotional blockages are released with the Shirodhara and Hardhara. So yes, it's a good experience, and I think one must experience it at least once to see what it feels like, because when you do Panchkarma, it's a completely different experience, and the process is very, very intense, I would say. And when my patients used to be when I used to be working in the Malad Center, and when my patients used to be traveling back to their respective country, I would tell them, when you carry delicate stuff in your bags, you put a fragile stick. I wish I can put a fragile sticker on you as well. Because that's how your body is. It's very delicate at that point, very fragile, and you need to take care of it. And when I say you need to take care of it, so for both Gidre and Steve, when you come back as well, make sure you follow the diet. I'm sure the doctors there will give it to you, but just follow a good diet, follow the plan that is given, a few home things that would be asked to do. This is just to further enhance the process, and your body has gone through a cleanse, and we do nourishing then. So we do rasayana. So that is very important, because we have cleaned, now we need to nourish the dhatus, the tissues, everything we need to nourish. Yeah. So make sure you follow the rasayana after you come back, because that's where a lot of people slip. When they come back, the life gets busy and you get into your day to day and you forget about the rasayana bit. But make sure you follow the rasayana. Very, very important after the detox. All right. Okay. Gidre, do you want to share anything?
Yeah, I very agree with Steve. Everything, but I just want to add that before Panchakarma, it is good to prepare as well. So that 1 month or even more. So it is good to follow diet, everything. Then your Panchakarma will be easier and lighter. Like, because for me, it it is quite good and easy, I would say. But I was following diet before Panchakarma,
That's
so
good.
yes.
That's good. And I think you've raised a very important point, and that's to a lot of my patients who travel from here to do Panchkarma in the center. I put them on a diet 15 days before. I start a few herbs 15 days prior their travel, so that their body is already in that process of cleansing and it's already lighter. So when you start the process, the impact of the massages or the treatments is better, because you've already flushed out some armor from your body. You've lightened, reduced the armor from your body. So it's a very important thing as well. And sometimes when people cannot give 4 weeks time and they say, no, I have got only 3 weeks, then I prepare their body over here with a few things so that when they don't have that 4 weeks, the remaining part can be started from India. So that's another way of working around panchkarma when you don't have 4 to 5 weeks to go and live in a place. So yeah, that's a good thing.
Yes.
So which is your
Dr.
favorite?
Meera, what is
Yes.
the paste that they make the wall? Like they make a wall? What is it? What is that? What kind of flour do they use?
So is it the towel, the potli what they make, the bundle?
No, no, no.
It
They,
means for the
you know, when
dala.
they,
When you have heart dala or kidney dala or spinal dala, you mean
Nidara.
yeah, it's
Ah,
urad
okay.
dal. It's urad
Yeah.
dal flour.
So it's urad dal. Urad dal is what lentil is it called in English? The reason we use that is because it is sticky. It sticks well. The whole idea of creating this wall or a boundary so that the oil stay inside, but it's very important that you stick it well on both the sides, on the edges, so that none of the oil escapes through that, and you don't mess everything around, and whatever we want to work on, that particular organ or part of your body receives all the nourishment that it needs. So it is
Can
made
you
with
type
urad
that in
dal.
the chat? Can you
Yeah, 1 minute.
type
Let me
that
just
in?
look.
Also, is there a particular oil for different parts of the body?
That's black gram, split black gram.
Black
In
gram.
gram, yeah. So let me just type here.
Thank you.
It's called urad dal, and into bracket, I'm going to put the English name.
Thank you.
So you can also, this urad dal, you can also sometimes mix a little bit with wheat flour as well. You can also put a little bit wheat flour and the urad dal both together. So if you say 75% of urad dal and 25% of wheat flour, just to make the boundary. And if you don't find urad dal, the black split dal, you can also use wheat flour as it is, but just don't make it very dry, make it a bit more moist. And then you can put, and to be even more sure that you're not spilling anything out, you can cover it with the towel on the side.
Yeah.
Yeah.
And the oil you said was called black garam?
Black gram.
Gram.
GRAM. Sorry, I just put black dal. Split black gram. That's the urad dal. So this dal, again, it is just for it to stick well on the skin, nothing else.
Yes.
There's no main purpose of it.
Sorry, what was the name of the oil? The oil.
So the oil depends what you're working on. So say if you're doing nidara, you do it with samvatak oil and balda oil combination.
Samvata.
And balda oil.
Samvata. Balda.
B for Bravo, ALDA. I'll put it in the samvatak oil and balda oil. Yeah. So these two are for any kind of joint related problems. If you have, then you use samvatak oil and balada oil. Samvatak oil helps, and balada oil helps to nourish the muscle or the joint.
Sorry, Dr. Meera, what are these oils? What are these oils made of? I mean, I've never heard of these oils before. Could you please explain?
We have them over here. So it is it's a combination of few oils in it, few herbs in it. I think the base.
Do you buy them in England?
Yes, I have some here. Let me just get them.
You disappeared.
Hi, Afsane. Sorry to hear about your accident.
So see,
Good to see you again.
I've got the Samvata coil here.
You can't see it.
Okay.
It's
Oh, I hate these backgrounds.
I know. Samvata coil.
Yeah.
But you bought them from Shakti.
Yeah. And then you have all the ingredients here. So all the vata balancing herbs are used in this. And I think the base is more of sesame oil. The base, the oil that is used is morely, I think it's sesame oil base, and all the vata balancing herbs are put in it. It is boiled, it is prepared specially
So
with
they
all the
just
herbs.
heat that, don't they? You need to heat that when
You need to heat that, warm
pour
it.
And you know, after when they pour, I was looking at the videos and I noticed that they kind of half fill the dara. I don't know whether I'm saying it correctly.
Yeah.
And then they were
the reason-
removing it with a sponge. Do they then throw that oil away?
No. So you put it back in the container and you warm it again. And then if you still have spare after the treatment, you can save it and use it the next day as well.
Okay. For how
So you're
long
not
can you
throwing
use?
it away after every treatment. You can reuse them. I might have some
On the same
pictures
patient.
here.
On the same
Yes, on
patient,
the
Dr.
same
Meera.
patient. You can't on the same patient. You cannot use Mariam's oil on Afsane.
Okay.
Can I ask a quick question for Steve and Gidre? I wanted to ask if either of you did the Vamana therapeutic vomiting treatment. No, you haven't had to do that. I heard that some friends who are over there right now doing the Panchakarma had to do the vomiting, and I just wanted to see how that went for her. But if you
No.
have done.
Yeah, so how Vamana works is, Mariam, Vamana is done mainly for people with any upper respiratory situation, somebody who has sinus issues, hay fever issues, or allergic cough and cold. For that, or any lung situation, one would do Vamana, and it helps to clear the mucus, the kapha from the upper respiratory tract. But, with how much ever I have known Steve and Gidre, I think Steve is more Pitta and Vata related situation. So for him, Virechan and Basti would be the main line of treatment. For Gidre as well, Virechan and Basti would be more appropriate for them. So Vamana is not necessary for all of them.
Yeah.
So I'm planning to go. Fingers crossed, if I'm able to travel, I might go in August for 3 weeks, and I plan to do my Panchkarma. And I will definitely do Vamana. If I'm doing Vamana, I'm going to record it and I'm going to share it with all of you.
Yes.
So in Vamana,
Is it monsoon time in August? Is it monsoon
sorry?
time? Is
It
it
is
the rainy?
monsoon time, but that's the only time I can go with my daughter because she has school holidays. So in Vamana, what you do is it's a decoction with milk. So Yeshti Madhu is there and a lot of other herbs you put, boil it and make the person drink that water. So you keep drinking that water till you're full, till here, and you can't take anymore, and then you start to throw up. And that's how, so what the milk is going to do is milk is going to get all the mucus stuck to it, and it's going to come out along with the milk. So that's how it helps to clear the lungs.
And Dr. Meera, if say for example the patient is vegan and doesn't drink milk, they could just use any kind of liquid.
You could do alternative. You could do it with coconut milk as well. Yeah.
I was watching process of Vamana, but I would not say they were giving milk. It didn't look like milk. Maybe before they drink milk, but after they just, it looks like brown.
You can do it with
water.
water as well. So all those decoctions, you can mix it with water also and take it. So currently I do Vamana at home. And when I do Vamana at home, because again of my cough situation, I thought if I'm going to wait till I go to India, I don't want to wait till then. So I started doing small Vamanas at home. So in that, what I do, I take water, I put licorice powder, that's Yeshti Madhu powder, few tablespoons, boil it and drink that warm water, and then I bring it out. So I've started doing a little bit myself over here before I can go, rather than waiting till I go there.
I need to do that then, don't I?
You could do that. You could do that.
So licorice powder and water.
Water.
How much water and how much licorice powder?
So I take like, depends how much water you are able to drink. So I take almost 1.5 to 2 liters of the water. And if you've made extra, you can store it in a container and keep it, and you can use it tomorrow. Again, boil it and then use that water tomorrow. Say if you make 2 liters, and after drinking 1 liter itself, you feel, okay, I'm full, I need to throw up, I need to bring it out now.
Does it
That's
make
fine.
you feel sick? Does it make you sick?
It will make you feel sick.
And how much licorice powder you put?
I put in 2 liters, I put around 3 to 4 tablespoons.
Dr. Meera, when you take that, like how long afterwards do you notice an improvement straight away in terms of the mucus in the kaffa, or do you have to do like a few treatments and then
You
see?
have to do it. When you're doing at home, you need to do a few. But if you go at the center, like I'm going to go in, if I'm going in August, then I will do it over there. Then that is a proper process, because because here I'm not doing any massages or anything myself. I'm not able to do it on myself. So, but when you do the massages and all of that together, it breaks up the toxins. You need to do pinda swed on the chest, on the back to loosen up the mucus. And then you do the vamana. So the results are much better. And that vamana, if you've done it at the center, maybe then you do it after a year.
Mm.
But here, because I'm doing it at home, I would do it not every day, but at least twice a week.
And
Yeah,
you
or
boil
once a-
this for how long do you boil this
Just bring
licorice?
it to one boil. You don't have to do too much.
And
Just
then
bring
you
it
let
to
it
one boil.
cool.
And take it warm, lukewarm, whatever temperature you feel comfortable drinking, do that. But you have to
And
keep drinking. You can't drink a little bit, then go and do something else, and then come and drink a little bit. So you have to constantly
keep
sit in one place with your flask of water, keep drinking, keep drinking, keep drinking. With me, it happened once. I had the builders in the house, and I started that process, and they came. They were asking me questions. So I went there, I answered a few questions, I did something else. And then that momentum is gone, because then your body is already not digested, but you know what I mean? After 15 minutes, if I'm going to drink another bit,
it's gone down.
it's all gone down. It's all gone down. So I struggled that day, and I'm like, oh my God, all my 2-3 glasses what I've drunk is all gone waste. Now I can't throw up. So that is how it is. So when you
And
do it,
during
you
that
have to
time, you don't eat? No food in that
you have to
day?
do it empty stomach. You have to do it in the morning, empty stomach.
Oh.
Yeah, morning empty stomach. It's not that you can do breakfast, lunch, and then when you feel like doing it, you do it. It has to be done first thing in the morning, empty stomach.
And
Then
then
afterwards you can eat. After that you can
after
eat.
you're sick, how many times do you get sick? Do you empty
It
all of
depends.
it?
It depends from person to person. Sometimes you can just have one big bout and everything is fine. Then you don't need another one. You might have small few bouts. For me, usually I have around 1 or 2, not more than that. Yeah.
And then
Dr.
after that,
Meera,
you
I'm
can
just
eat.
wondering, sorry. So I was just wondering, did you have diarrhea because you kind of didn't take it out kind of thing that
No,
way? I'm just
no,
wondering, those 2 glasses.
because yes, licorice is not a laxative, right? So
Okay.
even if I don't, you'll just pass out in your urine.
Mhm. Okay. Okay.
Yeah.
Thanks. Okay.
And
Thanks.
I
And you
wanted
can buy licorice powder here? Sorry.
Yeah, you can buy licorice powder. I'm not sure if we have it in our Ayushakti single herbs. I'm not sure, because we now have a few single herbs. I don't think Yeshti Madhu is there yet, but you can buy it online if you want. I bought it online.
to ask about.
Go ahead.
It was for you, Steve, and for Gedra about the massages. I heard that some of the oils that are used it's quite spicy and strong. Have you experienced that? If you've had any of the dry massages or anything?
Could I just first say about this Vamana, because I'm sure Dr. Meera will say more on it, but here when we have the treatment, there are days before it that you're prepared for it. And one of the main concepts, one of the main ideas is that the toxins are moved to the digestive tract.
Mhm.
So if you're going to do Vamana, it's moved to the, upper part of the digestive.
Upper, yeah.
And the other way, if you're going to do Virichan, it's moved to the lower part of the tract. That's why when you do it on the Vama day, for example, you are doing something that's very concentrated because it's already been prepared for. That's right, isn't it, Dr. Meera?
That's correct. You're absolutely right, Steve.
And just to answer your question, my personal experience, none of the oils that have been used, if you mean spicy, you mean they have some hot
So
heating
yeah,
effect.
yes.
I don't experience that. I've had a lot of massages.
Mhm.
In fact, I get them weekly back in gym from someone who's been trained at Ayurvedic massage. But I never find it too heating, but that's probably because I'm essentially highly Vata and quite cold, so I don't notice that. But Geertrude, she might have a different experience.
No, I'm Vata as well. So
Yeah.
I'm really
You know
enjoying
what?
hot. So Pinda sweat massage for me, I like it a lot. But before yeah, they do Pinda sweat massage, they put some paste. I don't know what. And that paste is really, I would say, hot. You feel like heat on your body. Yes.
Mhm.
And I would
So
just like to say the other aspect of heat is, of course, the oil is heated. And from an experience over here, the practitioner will ask you occasionally, well, is it okay, the temperature of the oil? And for me, the hotter the better. I kept saying, no, it can be hotter, it can be hotter. Even on the daha, is it burning you? No, it's sort of hot, but it could be hotter.
same for me. Same for me. I'm
Right,
Vata
so
as well.
we have the same experience. And may I just say one other thing? I asked the question, these oils are medicated oils. They've got herbs in them that is helping the body have the desired effect. And so when you have a dharma and you have this dam, put around the area that you're having treated, you're putting hot oil in there. And my question was, well, that hot oil has contact with your skin. What difference does dharma make? Which I understand dharma means the stream of the oil. And maybe Dr. Meera would like to answer that.
Yeah. So what Steve is saying that in heart dara as well. In heart dara, we go in circular. So in all the daras, we're pouring oil in a certain fashion. So we're pouring, when you're doing heart dara, they will pour like this, slowly. They will pour it round. And when they're doing spine dara, they'll go like this, or sometimes they will go
Go like zigzag.
They will go zigzag. The idea is just to nourish each and every muscle tissue around there in that area, and because skin absorbs, right? So when you're doing that, it's getting absorbed into your tissues, into your muscles, into your bones, and it is helping you over a period of time to repair a lot of things internally. So that is what is dara.
The other thing I was a bit confused about, because I've got a lot of stiff joints, I thought like spinal dara was because of the stiffness in the joints, but actually it's as much or more to do with the nervous system.
Yes. So dara will also work on the nerves. Yeah.
And the same with the heart dara, it
Yes.
works on circulation, but it also works on the emotions.
Emotions. Yes.
And is
Even
that the same?
same with Shirodhara, it works on the nervous system. So, and it also works on the emotions, and it also works on blood pressure. Shirodhara works also very good on blood pressure.
Is that the one that pour here?
Yeah, you pour on the forehead.
But they pour it straight. They don't go for here. They just go straight.
They
Strips,
pour
like
here straight, and then sometimes we even go all the way as well this way.
this way.
Yeah, the whole or entire forehead as well.
And for the knees, they go round.
Knees they go round. So
Is
knee
it
dara,
twice?
if
Any
this is
any way round.
no. So even for knee dara, if you want to do it at home and if you don't have the flour, what you can do is you can just put a bowl underneath, a wide big bowl underneath, and just put your knee on top of it, and you can just pour, and the oil will keep collecting in the bowl down. And then you can again pour it into a small container, reheat it, reuse it. So for knee dara, even if you don't want to make the whole, the boundary with the flour, that's fine as well for knee dara. But for spine dara, neck dara, for heart dara, you need to create the boundary because
We
you
can
want that.
actually do that. We can actually do that to ourselves, right?
Knee dara, you can do it yourself at home if anyone has knee issues. Knee dara, a lot of time, we patients come for knee dara, and then because every day it's sometimes not possible when if your patient is living in East London, for them to come to me every day, it's a lot of hassle. So they come one time, learn how to do it, and they do it at home.
And you can use any kind of flour, really, isn't it?
You can, but I would say either wheat flour or black gram flour would be ideal to put because
Because it's
it will
sticky.
stick well. It will stick well. It will form a nice thick boundary as well, but along with that, it will stick well as well. But if you use, say, maybe gram flour or any other flours, it's not going to stick as well as your what you call black gram or wheat.
Stephen Gidra.
Dr.
Go on, Yasmin. Please go.
Sorry, are you sure? I mean, I can wait. I can go later. Yeah. Did you want to ask?
You go, and then I'll go after.
Okay. Okay. Thank you. Dr. Meera, my question was that do you use the same oils for all treatments? So, for example, the two oils you mentioned for knee and that knee dara, would you use the same oils for the other ailments?
No, for most of the joint-related issues, samvatak and balda oil, or muscle-related issues, pain-related, it's samvatak and balda oil. But say if you're doing shirodara, then the oils will change. If you're doing heart dara, the oils will change. Heart dara also depends for what you're doing the heart dara. If you're doing heart dara for the emotional reasons, the oil will change. If you're doing heart dara for cardiac situations, if there's any blockages, the herbs as well as the oils will change. So it all depends on what is the condition, and your practitioner, whoever is your practitioner, would be the best person to decide which herbs needs to be used, which oils needs to be used. But mainly for any joint pain related issues, it's balda oil and sambathak oil.
Okay, thank you. So would you mention the other type of oils for different ailments? For example, heart you mentioned, or for say emotional, or say for nervous system. What kind of oils would you use?
So for emotional situation, I would also sometimes use medhya gruth along with balda oil. But then again, if emotional situation is there, if there is a vata imbalance, then maybe a bit of samvatak oil also would be included in that. So sometimes it can be a combination of 2-3 different types of oils. Sometimes it can be, if I'm doing a heart dara where there is blockage situation and I want to do something, not a blockage, but if it is any valve related situation, or if I want to do nourishment, I might also use some pachak gruth. It's not always oil. Sometimes we use ghee as well in some treatment. Yeah.
Thanks. I had Shirodhara a long time ago in Thailand. It was such a nice massage, a good experience. And I like you were saying, emotional outburst, that I was in tears as well. I was like, why this is happening? So it was very, very relaxing. Yeah. Okay.
Friends, I have to help my mum with a food delivery, but I will come back up.
Yeah. So I don't know. I just wanted to go to a different topic from Panchkarma. Has any one of you watched the Dr. Smita's pulse reading session that she has taken?
Yes.
Yeah. So I would
Yes.
recommend
Many
all.
times.
Yeah.
Many
Practice
times.
it, practice it as much as you can, because practice is what's going to help you. And one thing I would like to say is, because a lot of you couldn't go to India for the session, so I asked Dr. Smita, can we do one session when she's here in June? She's going to be here in June from 11th to the 19th. And I said, you know, let's have one session here when we can talk about pearls, the day when she's off, and she has been so kind to give one of her day off to all of you
Yes.
to
Excellent,
learn a
excellent,
little bit more
really
about
Dr.
good.
pearls.
Meera. And Dr.
Thank you
Meera,
so much. Thank you.
Dr. Clint and Dr. Giovanni come here. Can we also have you and them and have a session with the three of you?
Yeah, when are they
That would be
coming?
great.
Come in June. So I'm going to ask Dr. I've already sent him 5 messages
Right.
saying, please do this for us. And
Yeah, we could have, and if you all have any,
you know,
suggestions on any particular disease or any particular subject that you would like us to take a session, we could do that as well.
yes.
Mm,
Dr.
Yeah.
Meera,
be good.
in you know, when they were talking about in the one of the videos of pulse, Arshia felt 2 pulses for a pregnant woman. Which finger do you feel 2 pulses for a pregnant woman?
Mainly
Is it
in between Vata and Pitta.
in between Vata and Pitta?
In between Vata and Pitta. So you will feel one pulse just in between Vata and Pitta, just pushing up like this. And so one is the mother's pulse, and the other one is
Baby.
fetal cardiac fetal pulse.
And and you know how whether it's a boy or a girl?
Yes.
How?
So to find that out, we check both hands, left and right both, and that we can find out. Yeah. I always keep forgetting whether if it's a left. I'm not too sure whether it is left or right, but I think if it is felt more in the left, it's a boy. If it's felt more in the right, it's a girl.
It's a girl.
Yeah.
Doctor,
And
Wow.
sometimes
Doctor,
you know.
Dr. Meera, would you like to say when such a pulse is felt on a man, what it could be?
So what kind of a
What?
pulse?
The pulse between the Vata and the Pitta finger.
Sometimes even prostate-related pulse can be felt like that. So in between the Vata and Pitta. So it's important to understand where it is coming from, how it is. So all that will come in with experience, more experience. But a lot of time, Vata Pitta between men is felt between the finger is more of a prostate-related situation. It's like a fountain. It's like going up. So it's most of the time it's prostate-related situation. If the prostate is enlarged or there's some inflammation in the prostate, you can also feel that kind of a pulse.
Also,
But pregnancy pulse is slightly different from that. So it's not the same. It is slightly different.
you can also feel fibroids in that place in women.
Yes. So fibroid pulse also does come up. So any kind of a growth pulse will always come up like a fibroid also sometimes comes up like a fountain, heavy, but like a fountain. So if you have a water fountain, or when you go into the pool sometimes, and there's a small things where the water is coming out from, and if you put your feet on it, I don't know if anyone of you have, it is that kind of a pulse when there is a fibroid. Yeah. So that, and like I was saying, the more and more you people can feel the pulse, experience it, it's going to be very helpful. So even when Dr. Smita is coming, maybe it would be good to sit inside with her for maybe hour each, and not talk, not give your opinions, just sit quietly and just observe, and then come out and then sit next to any other practitioner who are explaining the diet, sit by them, observe. If you feel the pulse, I think that's how I have learned. So I'm just sharing how I have learned. The more you will just feel the pulse, and first identify Vata, Pitta, Kapha, work a little bit on Ama, Agni. These 3, 4 things, if you can master, then, rest all will come slowly, slowly, slowly with more and more experience. So when Dr. Smita is there, come observe. So, not Afsane, sorry. Mariam comes a lot of time to my clinic, and she sits and she listens to me when I'm talking to the patient. She tries to understand what I'm explaining them from the pulse, what prescription I'm writing, what diet I'm giving. And while I'm talking to them, she will go and quietly take the pulse and see what she feels. Then she will compare with what I have written down and tries to compare it, saying, see if she's got at least Vata, Pitta, Kapha right. If she's got Ama, she does that. And then once the patient has left, and in between, if we have time, then we will discuss that what I have felt, why I have given certain herbs to the patient, how this is going to work on this patient, on this client. And so that is a good way of learning, of understanding the herbs, the diet, disease, all of that. So I think if you all can do that slowly, slowly, even if any one of you want to come and sit when I'm seeing patients, you're more than welcome to come and see. Even if it means if I have 3-4 patients in a clients in a day, it's worth those 3-4 clients as well if you're not living too far away, because that gives you an experience, that gives you more idea of the pulse, and you can relate to what I have seen and what you are feeling. You can compare the two. And maybe once we can organize, if you all have any particular condition or any disease or any particular topic, you all come to a joint decision that yes, we would like to do this particular topic, then we could do a webinar, or you all are welcome to come to my house and spend a day together, understand the subject better. And what Dr. Hemang was talking about, webinars. So even if you want to organize, say you have a community, right, or any social group that you're a part of, and they are willing to, there are a lot of women's group, there are a lot of men's group. So if you want to organize in that group any talk about Ayurveda or any particular subject. So I have a patient here who is a part of the women's group. And she came up to me one day and said, is it possible for you to give a little talk on women-related health issues? They said, we are a group of women who are either in our late 40s, 50s, or 60s. So, some are going into menopause, some have gone into menopause, and they're all juggling with this situation. And if you can talk about it, I said, yes, why not? I'm happy to do that. So, talk about why you're going through this, what's happening in the body, what is changing in the body, how you can work with diets, few home simple things in your kitchen that you can use, and you can balance few things in your body. And I think those things are very helpful, and it's a community that is there, and it helps to relate to each other, that it's not just me who's going through this, there's somebody else who's going through this as well. Even in men these days, after the age of 50 or so, men go through a lot of changes as well. They are going through hormonal changes. They are going through the menopausal situation, hormonal situation, which nobody talks about. And it's important to talk about this because they go through it as well. They get night sweats as well. It's not just women. Even men get night sweats. Even men have mood swings. Even men have, but sometimes in the society men don't express when they have these feelings, but they go through it. They have prostate situations, like we have fibroid situation, menstruation, heavy menstruation. They have prostate situation where they find it hard to pee sometimes. They don't get a good stream. They have, other men-related situation, erection, ejaculation situations after a certain age. Like women have dryness in the vagina after a certain age because of the hormone changes. Even men have these situations, but they don't talk openly about it, or they don't discuss with each other. Whereas we women are more vocal, we'll talk about it, we'll share our problems, whereas a lot of men don't do that. So, even if there's somebody, a men's group who would like to have a little bit of talk about what body is going through the changes after a certain age, it is a good thing to do, and you can help, or you can touch so many different souls that way.
That's a great idea.
You
That's a
can do
great idea,
online
yes.
webinars, or if there's a community, a lot of time these communities, they rent out, or they rent out community halls and they meet up in one place, and it is followed by, snack or something. It's a way of meeting, socializing. And that's where a lot of these talks happen. They invite one person, some person in between. Say if Afsana is a part of any of that group and Afsana says, oh, why don't we pick up a topic on health, and we can have an Ayurvedic practitioner come and talk about Ayurveda to us, So just giving you ideas, all this can happen. So there's a group for polycystic ovaries over here in London, and I gave a talk to them. I did a webinar for them on polycystic ovaries. Young, polycystic ovaries in women starts as early as 14 as well, and it can go up to the age. There's no limit to that. So there were variation of age group of people. There were 16-year-old, there were 20-year-olds, there were 25, 30, 40-year-olds as well. So it was a wide range, and I just spoke about PCOS to them, that how Ayurveda can help them with PCOS, what lifestyle changes they can do, what dietary changes they can do. And that's a good way for all of you to learn as well.
Sounds
Yeah. Even if you have like your Facebook groups, your Facebook friends, and if you want to say, okay, would you all be interested in doing a bit of an Ayurvedic session? You never know how people would like it.
Yeah, this sounds good. I'm definitely going to start thinking about it and see if
Yeah.
we can organize something, even maybe for the European call.
Yeah.
I think some people would be interested in a webinar.
Yeah. So see, you all are 10 of you. So even if one of you organizes it every month, you have 10 webinars every month. We can cover so many diseases. Each month we take one disease. You can cover so many diseases, and you can in person or online webinars you can do. And then maybe we can give a feel of pulse to, if it is an in-person thing, we can give a feel of pulse, do a pulse taster session, and to make people understand that there is a different way of treating yourself as well. It's not always necessary to go the conventional way. You have natural way of treating your body as well.
I'm just thinking about how at the moment there's more people with hay fever, because sort of the season is coming. So maybe something linked to that could also be beneficial, to sort of reduce the kapha that's coming up in the body. I know that my sister and her partner both suffer from hay fever. But it's
so it is a good topic. You can pick up topics as per season.
Yeah,
you can do that as well. Or you could pick up a topic of dincharya. What is dincharya? Dincharya is your daily routine. What things you can incorporate on daily basis to live a healthy life. You could pick that topic, or you could, depending on what kind of group it is, or any topic that you feel will be helpful to the people you know, or a group of people. You can pick any topic. I was doing these webinars on every month. Last year I did till before COVID. I was doing one topic every month, and I used to send invites to all my patients, and they used to attend those webinars, and they would tell their friends, family, saying that, oh, there's this webinar if you want to join. And it's a free thing, it's free knowledge, free education. And a lot of people used to come, and they used to have so many questions, and they were amazed that you can treat certain things with in a natural way.
I really love the daily routine
Right.
that you've suggested.
Immunity could be one area. So with COVID and everything, how people increase their immunity, or for a women's group, menopause could be one.
Yeah,
those kind of things.
So I'm happy for you all to, give me the topics that you all want to do. Maybe you can put it on the group, the topics that you want to do, which day works for all of you, and you can invite your friends, family, and they can all be a part of it. They can listen to it, and maybe you can take suggestions from your friends and family. Is there anything health related situation that is a concern for them that they would like to learn, know more about, to work in a natural way? So you can speak to your friends, family, and get their suggestions as well.
So what would be the minimum number that you would be able to say have a webinar? Minimum
we can
number
do
of
as many.
people.
No, we can do it with 10 people. We can do it with 5 people. We can do it with 20. We can do it with 50. We can do it with 100. So
Okay, excellent. Yeah.
no minimum numbers. So sometimes when I used to do webinars on my page and I used to have 30, 40 people, that's fine as well.
Mhm.
Dr.
Some days,
Meera,
depending on what topic it is and how many people get interested in that topic.
Mhm.
If it is a
Yeah.
very common problem, say if you pick up a topic like eczema, for
Yeah,
example,
I was exactly thinking about that, asthma and eczema.
or don't even pick up just eczema, pick
Students.
up skin allergies, rashes, or somebody gets any
Yeah.
skin problems. If you pick up
Yeah.
a skin, then we can talk, okay, why do skin problems happen? What is the root cause of skin problems? How we can work with diet, home remedies, and few herbs we can add to it, and how you can benefit from that. Or you could pick up a common topic like menopause, which a lot of middle-aged women are going through. Or you can pick up topics like arthritis. Like Mariam suggested, hay fever is a good topic. A lot of people suffer with that. Digestive issues is another good topic. A lot of people suffer with digestive issues, sometimes not knowing what it is. Or sometimes you can also pick up a topic like detox. It could be a topic as well. How to detox on that regular basis. And then another topic I suggested was dinacharya, your daily routine. How can you incorporate Ayurveda in your daily life? There are plenty of topics. So what I want all of you to do today is pick up one topic that you all would love to hear about. And we can come to a decision of one particular day and time in a month when we can do these topics.
Dr. Meera, each Friday,
Miriam, I'm not sure if it's getting recorded anymore.
it is. It's still
It is
recorded.
recorded.
It is
Okay.
recorded. Each Friday, I'm one of the co-hosts on the European call, and so different people come and join, even people from America. And I know that they would love to have you on there to talk about, even if it's Ayurveda with daily routine or detox. Is 7 p.m. too late for you though? Because the call starts in the evenings.
That's fine, no problem.
Okay.
We can do it one day.
I'm going to contact you.
But you'll have to give me a good notice, because I would like to prepare some PPT for it, PowerPoint presentation, so everybody can see it. And later on, if they want, we can share it with them as well, so they have it with them and they can go through it whenever they want to. So we could do that as well.
That's wonderful. Yeah, no, that's wonderful. We already have
Great.
yeah, it's perfect. Yeah,
Yeah.
we'll coordinate.
Yes.
I know I think we've probably gone over time, but for the next session, can we talk about, and I know that Afsana mentioned this,
Samanya and Vishesh.
yeah, because that's the one where I didn't do very well in the test. I just kept getting confused with opposite substances, so Dravya Vishesha and the quality one, Guna.
Vishesh.
Yeah, I seem to confuse it, and I was trying to talk about reducing the pitta in one of my clients, and then I just got confused which was which. So,
rather than using this time where we can discuss cases, and the mentor-mentee meeting is more to discuss about cases and pulse and what we can do together, maybe we could organize one separate call apart from the mentor-mentee, so that this is an additional thing that I'm happy to give for all of you. And we can talk about that in that call rather than, using this time for that.
That would be wonderful. Yeah? I would really appreciate that.
That would really be great. Thank you. Dr. Meera, you said that sometimes you work also on a weekend.
Yes.
You have clients. Is it possible that I could join you on a weekend?
Absolutely.
If you tell me what dates.
let me tell you now itself, so you can plan it. So I have a few patients on the 23rd. I've got almost six appointments on the 23rd of April.
Excellent. What day is that?
It's a
23rd.
Saturday.
Fantastic. Can I come to you?
Yes, you can. And Sunday, when that is the 24th of April, I'm in Leicester and I have around 16, 17 appointments on that day.
I
In
can't go
Leicester?
to Leicester.
Yeah, no, I'm just saying the days when I have
That
more
would be great
appointments.
if I could go.
Not
But
just you, if anyone else who can come to Leicester, you're more than welcome to come there as well.
okay, I put that in group chat that you're
Yeah.
going to Leicester.
Yeah.
And what time would I need to be there?
So on the 23rd, first appointment is at 11 o'clock.
Oh, great. I can wake up a bit late.
So if you can be here by 10:45, 10:50,
Yeah.
maybe 5 minutes before the client comes. And also sometimes some clients are not comfortable, but most of them are fine. But some clients may not be
If they don't
comfortable.
want, I wait outside.
Yes, but
And,
then you still
know,
have the
I'm easy.
caretaker. But Mariam has been here and none of the clients have been difficult. They've always said, yes, you can check my pulse, no problem. And they are happy to even share their progress and other things. So most
Yes.
of them are happy when they know you are learning, they're happy
You
to.
just tell me and I'll do it. You know, just being with you in the same building gives me good energy and good vibes. Thank you.
That's good.
Then
Yeah.
that's on the weekends and yeah.
Okay.
Okay,
And Dr. Meera, can I please
really
also
appreciate that.
maybe come sometime after these 2 weeks? At
Yeah,
the
no
moment it's
problem.
this fasting month. So
Yeah.
how do we arrange? Do I text you or
Yeah, just message me.
let me know?
Just
Yeah.
message me. You're pretty
Okay.
very much local, so just message me. Even
Yeah.
if it means I
Mhm.
have two appointments on the day, for you it is
Okay.
fine because you're close by. It's not a massive
Great.
travel for you.
Yeah,
So
sure.
feel free. And if any one of you are organizing online calls,
Mhm.
video consultations, you're always there in those calls. So that's a good
Yeah.
learning as well, because when Steve had organized for his few family friends, his daughter, and Steve can share that how even by looking you can identify a few things and help your patients. So sometimes people are far away, they can't make it for pulse reading. Even video consultation helps. So if somebody is far away, don't emphasize, no, you have to go for a pulse. If they're far away, do video consultation. But if it's an hour's drive, then yes, tell them, no, it's good to do a pulse consultation. But if there's 2-3 hours up north somewhere where they can't get to me, then absolutely video consultations.
Dr. Meera, when we make appointments with you, I get embarrassed when they say they don't want to buy the herbs. I
No, that's absolutely
feel as
fine.
if they must buy it.
No. Never
Get
force anybody
embarrassed.
to do anything. Never force anyone to do anything. It has to come from within. The voice from within has to tell you, yes, I want to get better. I want to do it.
Yes, but
So
sometimes they really genuinely cannot afford.
I understand. And
You
if
know what
there's
I
somebody
mean?
who cannot afford, and if it is a very known person to you, and if you can discuss with me, I can work out how we can help. Because what we want to do is help people. If they can't
Yes.
afford it, in whichever way, maybe if you prescribe 3 months herbs and they can't pay for all 3 months together, we can work out, okay, you can pay monthly. So if it's say £300 worth of medicines, you pay every month £100. Sometimes that is more affordable, more practical for people, or sometimes
Yes.
when they just can't afford or they need those medicines for a long term, we can provide some discount to them. For people who can't afford, we can provide some additional discount, so that the purpose is to help in whichever way we can. And if it means, even if they feel that, okay, by following the diet, home remedies, lifestyle changes, I'm going to give it a try, at least there also you have touched somewhere to that
Yes.
person. And when they see that by following the diet or making the lifestyle changes, they can see, yes, I can feel the difference. Then maybe they have developed that. Sometimes they don't come with the faith, and And if you feel they're not coming with the faith, you tell them, okay, you just follow the diet, follow the home remedies, follow the lifestyle, see how much better you feel. And if after that, if you feel, yes, I'm feeling better, and then herbs will add on to your condition, your progress as well.
Thank
So
you.
let them make their decision. Let them decide for themselves. Don't force them for anything, because the moment you force to anyone, if I force you that no, you have to be here on this session, you have to do this, you will run away. You will say, oh, what is this? I don't want to be forced to do anything.
Yeah.
It's the same whether to go and see a doctor, whether to take the medicines, whether to follow the diet. So you have to let them decide for themselves. Yes, guide them, make them understand why it would help you, and then leave it on them to make a decision. Don't force them.
Well,
And
I'm
don't
always
feel
paid for
bad
them,
or don't feel
paying
guilty
for
as well.
everybody that for anybody that I make appointment for, I pay for them. And
Oh, bless you, Saleh.
I think, okay, you know, and then basically many people say yes, 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 because I talk about it constantly. And
Yeah.
I have many videos that Dr. Clint has sent me because I'm translating them. They're short, small little videos of healings for Crohn's disease, for Alzheimer, for whatever. And so I show it to them, I share it with them, I talk about it, I invite them to Zoom calls, and then they're all yes, yes, yes. And when I say, okay, now I want you to meet Dr. My mentor, she's amazing, she said, and then it's okay, I'm fine, I don't have any problems. No, you must see. you try it and you see. And I haven't actually had anybody who has very willingly said yes, except for the
It's
three
a,
people that came to see Dr. Smita.
it's
And they
a
just,
it's a journey. It's a journey which they need to plan themselves.
yeah.
Yeah. It's like nobody can force you to go on a journey, right? You have to plan, you have to decide, you have to do it yourself.
But you know, when you love someone,
Yes, I
you
know what you
want them
mean. You
to,
know?
you want them to do this.
Yes, I know what you mean. I know I have done those things as well. Like to some of my friends, when I see they have health issues, I keep telling them, this will help you. Don't go for the surgery. This is going to work for you. And it doesn't get into their system. It doesn't get into their brain because we're so used to conventional medicines. A lot of people are so used to conventional medicines and everybody's looking for a quick fix. Sometimes people don't have the patience to take the herbs for 4 months, 6 months, a year, because they think, oh, what a waste of time this is, when I can fix that my situation by taking antibiotics or taking steroids for a month. And if I can resolve my situation, why do I need to do this for so many years? My own example, my lung situation, I I have my friends who are doctors and they say, you're such a stubborn person. Why wouldn't you just take the inhaler for a few months? You will feel better. Why wouldn't you just do it? And I'm like, no, because I know what in the long term how it's going to affect me. When I saw the respiratory consultant last month, I told him, I said, okay, you're prescribing me this. Do you think it's going to, if you say, okay, yeah, you tell me you take these inhalers for 2 months and your situation will be solved. Is that possible? So he says, no, you might need to take for long. I don't know how it would work for you. You might need to take it for a lifetime. Then I said, then I don't want to do it because, I would rather take my herbs, which I know will take long time, but I know it is going to get me where I want to, even though it means, suffering for a few more months. I don't mind doing it. So
Yes.
you have to be prepared for that. You have to be willing to do that. You want to work through the root cause. And that's why these webinars, what you will do, talking about disease, that will create faith.
Actually,
Generation is very, very important.
actually,
Could
Dr.
I just
Meera,
say one thing about creating faith? Because in perhaps more than one talk by Dr. Smita, she's emphasized this, that you need to do something, give something to a client that's relatively easy for them to take on board and will give a quick success, because it's exactly this point you're discussing now, that you know, people have a very different attitude to their healing with regards to speed, and also what they're prepared to put into it, either in terms financially or in terms of effort. So the very first step Dr. Smita emphasized is that we need to find, whatever it is, a way to allow them to see a quick change, because that encourages them to have faith in the system.
Yes. That is very true. So even when Dr. Smita sees, or when I see patients, I do tell them that this is the root cause, and I do ask them so there are 5-6 different health conditions that one would have sometimes. And then I ask them, what is your priority? What is the most important for you right now? And they will say, okay, like today this patient was there, and I'll show you her case paper. Where's the paper gone? Yeah, so this lady came to me today. I felt so many things in her pulse. So autoimmune, heat, hormonal imbalance, low circulation, all of these in the pulse. And she had urticaria for many last 2 years. Then she's got her white blood cells are high, her platelets are high, and doctors have said it's an autoimmune situation she has. And she was so amazed that even just looking at the pulse, I told her there's an autoimmune situation. And she was like, how did you? So that is again creating faith. Yeah, that is creating faith. Then, oh, my doctors had to do a blood test to understand that there is autoimmune situation. And here she is able to tell me through the pulse that it's an autoimmune situation. And this lady, 25-year-old, she works as a physiotherapist in NHS. So she was like, I'm amazed to see how you could just tell it through my pulse that I have got an autoimmune situation. And a few other things I told her, and she's like, I'll do whatever you want me to do, because I know I will get better here. And I started and I asked her, what is your top priority at this point? Because I felt hormones is a situation that I need to work on, circulation I need to work on, I need to work on the heat, I need to work on autoimmune. So these are the 4 things that I felt I need to work on her. And she said, for me currently, my urticaria is my key. Right? So if you see the prescription that I gave her, oh God. Oh. Sorry. So the prescription I gave her was more, I said, I know urticaria is your situation, and urticaria is coming from autoimmune. So I'm definitely going to work on your autoimmune, and I'm going to work on your blood circulation. And the Meta Boost, what I give you for your blood circulation, will also help with your hormones indirectly. So I gave her Meta Boost, I gave her Immuno, I gave her Virachin to flush out the Pitta heat from the body. I gave her Suniram, I gave her Skin Tonic. But in her mind, I have made her feel that I'm working mainly on her skin. But along with that, I'm working on the other things as well. And I've given a Sudarun lotion to apply locally on her urticaria. So I'm working on everything. And she said, what about my platelets and my WBC? I said, that is coming from the autoimmune. And I've given you Immuno. So that's going to work on it. And we'll see. She's going to see me again in June and remind me to discuss about her, about how things have changed for her. And then there's this one lady I saw yesterday. She is from Czech Republic, I think. She's married to an Indian guy, and his whole family is my patient in Leicester. And so the husband brought her to me because she had health issues. And poor thing, yesterday, she was coming from, her flight was delayed by an hour. So she was supposed to see me at 5:30 in the evening, but her flight was delayed by an hour. And then, there was another technical issue with the aircraft. So there again, a further delay. So she came at 7:30 instead of 5:30, 2 hours delayed altogether. But she had severe headaches, a lot of cramps in her legs. And she was diagnosed with clinical migraine. She had digestive issues. And yesterday when she came, she was almost feeling, so first time she came to me was in October. And then this time when she came, she said, I can't thank you enough what you have done for me, because I have seen so many doctors for this problem and nobody have been able to pinpoint why I'm feeling like this or why my body is going through this. And she's like, I've taken these herbs for good 5 months and I see a good change. She doesn't get cramps in her legs anymore. Her migraines are much better. So before she would get every week and it used to be very severe. Now she gets it once a month, but very mild, where she doesn't have to take any migraine tablets. She's just managing with the herbs and the diet. And she had digestive issues. That has got better as well. So a lot of things has changed. And she herself said that, I remember you told me diet will play a big role. And she says, I can see that the moment you saying the first 3 months I followed the diet 100% the way you told me, and I saw a drastic improvement in my health, and that kept me going. And so that's again faith, right? You have created that faith, and the patient starts to believe that yes, diet is working for me, it is helping me, and she continued it, and she's still doing it very well. So these are the few examples that I'm giving you, that how you can create faith in your patients, in your clients. And also these webinars that you would arrange, where the reason I'm saying I will need good amount of notice, because I would like to put some cases over there where my clients or any of our Ayush Shakti patients have had very good results. That will be faith generating as well. Say suppose Steve says, okay, Dr. Meera, can you do a webinar on IBS, for example? And I said, okay, right, let's do a webinar on IBS. We do a webinar, and maybe some of his friend might be suffering with symptoms of IBS, but not sure whether it is IBS, might go home and say, okay, let me try just changing my diet and see if it works. And he or she might feel a difference in that by just changing the diet. And there you have created faith in that person. So there are a lot of ways you can create faith. But like Dr. Smita says, it's important to give relief in their most burning health condition in the first, at least in the first 30 to 40 days, some improvement. So say if somebody comes with eczema, and if we can reduce the inflammation a little bit, or even reduce the itching to some extent, or the dryness in the skin, then they have faith. Then they say, oh, it has worked. In 1 month and my skin is not as itchy as before, or is not as inflamed as before. I can see it's working. And then they will come back to you. Right?
Dr. Meera, I just remembered something. Our most recent task that we have to do is to recommend the diabetes diet to somebody who's got diabetes, and they're meant to follow it for 15 days. And we sort of like ask them
Monitor
to.
it.
Yes, but if we don't know anybody with diabetes,
Yes.
is there a way that we can maybe do this as a group? And if you have like a patient, and you can maybe like update us weekly or something, because or after 1 week, and then the next week, just so we can see. Because I was like, I don't know anybody. How am I going to do it?
Mariam,
My
you can
problem
have
too,
me.
Mariam. I've
You
been
can have
asking,
me.
do you know anybody
You
who
can
has
have me as
diabetes?
case studies. You can have me as case study. I've got diabetes.
Oh, really?
Yeah, see, there you go.
Perfect. I'm so
You
glad
put
I
it-
asked the question. Yasmin, we
You
need
put it
I'll be your
out.
guinea pig.
You put it out in the universe and you get the answer.
Yasmin, we need you to follow the diet and post little updates in the WhatsApp chat.
Yeah, so I know Yasmin struggles to keep up with the diet. So Yasmin, this is your challenge
Oh
for
dear.
next 2 days. Okay, you're going to follow the diabetes challenge, and you're going to update on the group how you're feeling.
Yeah, and
Oh my God.
Yasmin,
I made a mistake here.
Yasmin, I'm so excited. You can take pictures of the meals that you're preparing.
Food, yeah. Video it. And
Oh
eat
dear. Oh dear.
every day.
Yasmin,
I'm not
Yasmin
a
is
very
thinking, why
mediocre
did I
friend.
open
Yeah,
my
I'll
mouth? Why
try.
did I commit to
Actually-
this?
Actually, on this topic, Dr. Meera, I was just going to ask this question from you. I was thinking, I have a burning question, and that is, if a client or a patient is not following diet, or well, how I wanted to ask this question, the supplements or the the herbal supplements, does it affect their effectiveness if somebody is not following a diet? That's what I wanted to ask. Yeah.
Right.
So if I'm,
So
say, for example, if I'm not following the diet that I should be, would it affect the effectiveness of the herbs that I'm taking?
if you're not following the diet, so what will happen then is your results might be slow,
Mm-hmm.
right? So if I'm expecting to see some change in 2 months' time in you, it might take 4 or 5 months.
Mm-hmm. Okay.
Yeah.
Yeah.
Just give me one moment. Just one moment. Yeah.
Okay.
Yasmin, remember what Dr. Naram said, the 5 keys, that if you follow them, then you see the result that you want. So obviously,
True.
if one area is missing, then it's going to slow down the result.
Yeah, I think I need to leave this family and go somewhere. I'm not cooking for anybody, and I'm just
So-
can
I'm
follow.
going to live here.
So Yasmin,
I'll come.
coming back to your question.
Yes.
So even when my clients come to me and they say, I can't follow the diet, should I take the herbs? I tell them, continue taking the herbs, because the herbs are going to work, but maybe it will not work. You'll not see the results or the progress as quick as you would see if you combine both together.
See, I
Yeah.
follow a strict diet and like mung beans and all that, be very careful and all that. And then after a week or 1.5 weeks or 2 weeks, then I just give up and start taking things, and I thank God, because I don't know what to eat, and so I really struggle. So
Yasmin,
I've been honest.
we
Yeah.
need you to do 15 days for us, okay? You've got to commit
Yeah.
15
So,
days.
so Yasmin, I
Yes.
think that's a good thing for you, because if you have to report to somebody, right?
Yeah, I
At least
know.
it works for me. It works for me. If I have to report to somebody, then I will put in my 100%, because I
Yeah.
know somebody is watching me, somebody is monitoring me. So
Mm.
what I would suggest for you would be, every meal you eat, take a picture
Oh
and
dear.
post it on the group. So that way you will be forced to eat healthy. You will be forced to follow the diet. You would have no excuse.
Okay. Yeah, I can try that. Okay.
Give that a
I
go.
wanted to, yeah.
Thank you,
We will
Yasmin.
support you in that. We will support you in it. Trust me.
I was thinking this group that I'm thinking of, I don't know how this will work out, but a lot of women have got diabetes and all these typical problems, so I think it will be really good for them
Okay.
too.
So
Yeah.
that is Yasmin's challenge. And one challenge that I want to do with all of you is, because I have been on a holiday, I have been a bit naughty with my food. So let's do one thing, 15 days. If we all can be on mung beans and vegetables, and post a picture of our food every day.
See,
What's
you
it?
got it. Yes. See,
What's
Me as
I'm
it?
well.
so happy now, Mariam. I'm very, very happy now.
Yasmin is thinking.
I can
It's
post
not
pictures
only
of mung bean soups and vegetables and things. I'm actually fasting, so yeah, I'll post my evening meal.
yeah, I was
Dr.
going to
Meera, you
say,
want me to do that as well?
Let's start from Tuesday. Let
all of
everyone
us.
enjoy
Okay.
the bank holiday long weekend. Okay.
That's a good
Enjoy,
idea. Let's do all
enjoy
of
it.
us together.
Gives
Yeah, that
everyone
would be
time
good.
to prepare as well. What food? Gidre and Steve are happy. They're thinking, oh, we don't need to make any effort. We are having the same food. We just have to click a picture and post it.
But Dr. Meera, you told me not to go on that kind of diet again.
No. You need nourishment. So you will put some rice as well in it. Rice or quinoa or some avocado, some good fats in it. Yeah.
Or khichdi. You can maybe
Yeah,
khichdi.
khichdi you can
I
have.
already eat these like these anyway.
Yeah, so just put pictures. Let's make our group more active, more happening, and let others see our group and think, oh my God, they're doing so much on this group. Why aren't we doing anything on our group? So
Why
let's
Yeah.
do
do
I
it.
the
mean,
same
it will
food
be.
over and over? Because I keep
I think
it
it
in the
will be good
freezer. I
as a.
don't have time to cook every day.
let's do
Yeah,
that.
yeah.
Let's do
As a
that
group
because
activity, it would be good. Yeah, good
because
motivation.
it
Yeah.
will support everyone. Some
Mm-hmm.
people like Yasmin who struggle to keep
Mm-hmm.
up with it, that will be a
Mm-hmm.
motivation as well, where
Mm-hmm.
she looks at others doing it and you feel, oh, they're doing it, why can't I do it? And
Mm-hmm.
I think we will all be supporting Yasmin in a way.
Yeah,
Yeah.
good,
And
good.
Yasmin
Yeah.
will be happy that it's not just me who's doing it, everyone is doing it.
Good
Yes,
idea.
yes.
Dr. Meera, I just wanted to say I had a really low blood pressure that I never experienced before. So I went to the doctor, nurse, and she said, "Oh, by the way, just send your blood pressure reading and whatever." So I did it, and I mentioned to my husband because I have no clue about the readings of blood pressure, and he said it's
Yeah.
very low. And so I had like very low blood pressure, like 71 over 41, 75 over 45. 2-3 readings were like that. And I mentioned I was feeling very, I can't go up the stairs. I'm feeling very, very lethargic and very weak. And I was wondering, what am I doing? I'm not feeling hungry, feeling dizzy, blackouts. I'm still having them. So then I keep thinking, what am I doing different that is making me that? And my thyroid readings were very, very, she was saying it should be 55 and it was 478, or it should be 478, it was 55, something like this. So all my blood tests that are recently done, they have all gone kind of haywire. My cholesterol is high, and I'm thinking I made this ghee and thinking, oh, it's wonderful for lowering cholesterol. So I'm a bit, liberal using with this ghee that are medicinal ghee that
Yeah.
I made at home. So 3-4 things have gone, and my hemoglobin is low. So I'm just wondering why this is happening. And I keep thinking about supplements. Is it to do with that,
It's
So,
nothing to do with the supplements for sure.
mhm.
Like I told you when you
Yeah,
messaged me as
yeah,
well. It's nothing
yeah.
to do with the supplements. And sometimes, in women's body, again, age, a lot of your body is going through a lot of changes, and it can happen because of that as well. And
Mhm,
some even, because your blood circulation has always been on a lower end whenever we've
mhm.
checked your pulse. And
Yeah.
with low blood circulation, even your blood pressure can be low sometimes. And
Mhm,
even what you call is stress can do that to you as well. When you have
mhm.
going through a lot of stress, that can
Mhm.
create a lot of changes in your body. So just
Okay.
just see if it is, if you feel that yes, you are stressed, try and work towards it as well, because sometimes we ignore stress. We think, oh, it's
Yeah.
fine, nothing to worry, but stress does have its own effect on the body.
Mhm,
So just
mhm,
work on that and see how you feel about it. But
mhm.
none of the herbs are doing it, none of the diet is going to do it, so don't worry about it. It's nothing
Okay.
to do with it.
Uh-huh. Okay. And say, for example, someone is having this, say, blackouts, I feel not fainting, but dark thing comes in, just 1 minute of dizziness. So
Hmm.
what remedy I can take
You can
that would
have a
help?
date. You can have a date.
Did okay.
Instant, if you want something, you can
Mm-hmm.
have a date.
Yeah.
Or blackout. You've got Meta Boost, right?
Mm-hmm. Yeah.
Take one Meta Boost straight away.
Okay. Good. Okay. Thank you. See, you've got a good case study here, people, of the group now.
I'm really happy, Yasmin, and I'm actually right now I'm taking pictures for you of the diet plan, and I'm sending it to our WhatsApp group. So you're going to be completely.
Send it on the group, and we'll all start from Tuesday.
Oh yes,
Okay.
perfect.
Okay, boss. Okay.
Everyone's going to be doing the
Okay.
diet on Tuesday.
Let's go shopping and stock up everything.
Is Monday bank holiday?
I make really good soup, mung soup with vegetables, with carrot and celery. So yeah. So maybe I can bring some. Yeah.
Okay. So let's end the call on that, and we all put an effort to support Yasmin, and also support each other to go on a healthy diet, because the weather and all the other factors can make you go haywire with the diet. So let's do that and see how we all get on with it. And even if you come up with some new recipes, post them as well. If it's something that you have created yourself, any recipe which would be helpful to others, put it on the group. Everybody can try it and give their feedbacks.
Okay, good.
Yeah.
Thank you so much, Dr. Meera.
You're welcome.
Thank you.
Thank
Take
you.
care, all
Thank
of you. Enjoy the rest of the weekend.
Thank you.
Okay.
And you.
All
Thanks.
right.
Bye.
Bye.
Bye, everyone. Bye.
Bye.
Bye. Bye.
Thank you.